Okay, so I want to tell you about a patient that I saw this week that kind of got under my skin a little bit. Not the patient, but the actual treatment. So this was a patient that I had seen 5 years previously, and we diagnosed with facet and SI joint pain. Facet joints are joints in the back where the vertebrae connect with each other, and then the SI joint is a joint on either side of the pelvis. They're often found together where a person will get facet pain and then walk different, which causes SI pain, although not mutually exclusive. In this person, they had facet and SI joint pain. On their exam, we treated both, and they were better for several years, also lost significant weight when they were better. So 3 years go by, and they stop doing their exercises, start gaining weight, and their pain comes back. Because they'd gained weight, they were embarrassed to come see me. So they went and saw another pain physician who did not perform an exam, and also informed them that they can't treat facet and SI joint at the same time, because in their minds they can't tell one from the other. So the problem, of course, is that the facet and SI joint are about that far apart, if you even do an exam. And again, one causes the other. So they do a diagnostic injection on just the facet joint, and the patient doesn't feel any better. So then they get an MRI. Now remember, this is a 65-year-old patient at this point. Anyone over the age of 65, whether they have findings consistent with the MRI or not, are going to have findings on their MRI. And in this case, the person had spinal stenosis. So they did an epidural. Because the steroid works for about 5 to 6 days, this patient felt better for 5 or 6 days. At which point they said, okay, the spinal stenosis is your problem. You need to do another epidural, and if that doesn't work, we've got major surgery planned for your spine. At which point, this person became frustrated, swallowed their pride, and came back and saw me. They have facet and SI joint pain. And I said to them, did you tell this other physician that this is what we treated last time? And they said, yes. And I said, did they do an exam? And they said, no exam. What I'll tell you is that if you have back pain and no one's done a good and thorough exam, you need it, and you deserve it. That's it. Thanks.